My name is Salam Kouraogo, President of the ARFOD, the Association for Research, Training and Development. According to me, the main factors for the creation of obstetrical fistulas are primarily socio-cultural. When women are married too young with an immature pelvis, they can have problems arising during labor. There are places where if a woman has her first pregnancy, she is forced to give birth at home. Home deliveries without help from a skilled healthcare worker. Often, labors occur very far from healthcare facilities, and by the time she is referred to one of them, the baby is trapped in the pelvis, which causes the obstetrical fistula. Another factor, which is no less important, is scarring from female genital mutilation, which can obstruct the passage of the baby through the genital tract. We could add gender issues because the woman does not have decision power for the decision to seek medical help, the decision to go to the healthcare facility to deliver. There are also the delays, the three delays: the delay for the decision to seek medical help when the woman is in labor, the delay to get the healthcare facility, and the delay for the payment. These are also factors responsible for the obstetrical fistula. At the level of Burkina Faso, a certain number of actions are being done to solve the problems contributing to the formation of obstetrical fistulas. Firstly, there is the creation of the emergency obstetrical and neonatal care programs. These are subsidy for all obstetrical care, such as the delivery and cesarean section. There are also awareness campaigns on the gender issues, such as the fight against female genital mutilation, for women's right, freedom of the speech, and right to education. There are awareness campaigns for the use of prevention services in reproductive health, such as family planning, birth spacing, prenatal and postnatal care for an early detection of problems linked to the pregnancy to prevent complications, such as obstetrical fistulas. Furthermore, we have the multiplication of healthcare facilities, which will reduce the distance between the healthcare facility and its users. The Burkina Faso government also makes an effort in recruiting and training the healthcare workers to have enough midwives, trained birth attendants, operating room staff for a fast management of obstetrical emergencies. According to the national policy of Burkina Faso, traditional birth attendant cannot perform a delivery at home. According to the national policy in Burkina, there is the peripheral level of care, the CSPS, the Center for Health and Social Promotion, and the second level, which is the CMA, the Medical Center with Surgical Antenna, and the third level, which is the CHU, University Health Centers. I'm insisting that traditional birth attendants are not part of the healthcare system in Burkina Faso and are not recognized as such, but we have to face it. Despite the fact that they are not officially recognized, they exist, they practice. But why do they practice their trade? There are elements that still justify the practice of home deliveries by traditional birth attendants, such as their social status. On the social level, they have a particular rank. They are part of the village elders. They have decision power. They are listened to for the traditional topics. Perhaps the village chief was even brought to the world by a traditional birth attendant. The training that we can give the traditional birth attendant for them to contribute to the reduction of obstetrical fistulas is to be able to recognize the dangerous signs during the delivery, because typically a woman in labor should not see the sun twice at the same place, meaning that labor should not last for 24 hours. They should know that after 12 hours, the woman must be brought to the healthcare facility. This is very important. Secondly, they must recognize certain signs of danger, such as arrest of labor progression, signs of uterine rupture, or cephalopelvic disproportion. They must recognize those red flags, and training could be focused on this. Even before that, training should concentrate on prevention, meaning telling every pregnant woman that she should have her pregnancy followed at least 3 times, and that is very important. If there is a problem with the woman's pelvis or passage through the genital tract, it can be detected by the midwives or auxiliary birth attendant, so that measures can be taken to provide a cesarean section to those women, which is practically free in Burkina Faso. It also means that the woman needs specific care during labor to prevent the obstetrical fistula. The birth attendant must also be able to provide information about the other preventive measures, such as family planning, which allows the woman to have a choice, a contraceptive choice, so she can decide on when she wants to be pregnant and not to be pregnant. This, of course, contributes to women thriving. So these are all the elements that we can give the traditional birth attendant to contribute in preventing obstetrical fistula. According to the national policy in Burkina Faso, the possibilities of reorientation for the traditional birth attendants are those previously discussed, such as being a mentor for the woman instead of having the role of delivering the babies. The role of mentor would be at the level of the prenatal care, identifying the woman in the community, women in their early pregnancy, to raise awareness and accompany them to the healthcare facility so they can benefit from an adequate prenatal follow-up. They can also play a role as a mentor for the family, so that when a woman is in labor, she can be transferred rapidly to the healthcare facility and play a role in preparing the birthing process. Which supplies should the woman prepare for the delivery? What are the measures to be taken? And she can contribute immensely due to their social status. They are listened to by the family, the husband, and the elders. Their advice is immediately followed. So if she suggests that the woman should be transferred to the healthcare facility during labor, the family will take the necessary steps so that a motorcycle and fuel be available for the transfer. A person could also be identified at the community level to accompany the woman to the healthcare facility to benefit from a safe delivery for herself and her baby.